Associate AD at the University of Michigan. I hope everybody's enjoyed the previous sessions. I'm glad to close out day one, addressing the importance of mental health during these uncertain times. I'd like to welcome my good friend and colleague, Dwight Hollier, Senior Associate AD at UNC Chapel Hill. Dwight, the floor is yours.
Thank you. I really appreciate the opportunity to be here. Appreciate the opportunity to great event. I will start by saying, when this discussion is, and I will also say that my Zoom is acting like it doesn't want to work. So I hope everyone can hear me. I apologize for the challenges right now. It's just like that to happen when you are starting a program. So I did want to say that this has been a challenging time today in just trying to manage the moment in preparing for this discussion. It's been a challenge on my mental health, and so I really do think about the mental health of our student athletes and how this must be challenging for them, and really want to encourage all of us to make sure that we are connecting and reaching out to our student athletes and letting them know that they have support in you, as I'm sure they do. When I talk about when I was first asked to do this, and Daryl, I really appreciate you and appreciate everything that you've done, and really the mentorship that you've had in my space, or for me personally, over the last few months that I've known you. You've really helped me out quite a bit. I'm Senior Associate Athletic Director for Student Athlete Health and Wellbeing at the University of North Carolina. I'm a licensed counselor. I'm a former football player at the University of North Carolina, and I played a little bit in the NFL. The space of mental health is a space that I've loved and cared about since I was a young man. And it really came from the experiences that we had growing up, where I wasn't poor. I was poor. I wasn't. We had some struggles. We had some challenges. I'm a first generation college student, but no matter what we had when I was growing up, we always had our door open for others, and it's that spirit, I think, that has always stuck with me, and it makes me more, or I try to be more aware of the sensitivities of things for our student athletes, for the young men and women that I've had the opportunity to be around and to serve. And when I thought about this first aid for mental health discussion, there were two things that were going on in my mind. One is thinking about the student athletes and what do we need to do to provide them a first aid kit on our campuses. But then I also thought about what are we doing to take care of ourselves and to put the mask on ourselves before we put the mask on someone else. So there were both of those things going on in my mind. And so as we think about this agenda, one, I want to talk about mental health, and really, I know that there may be some professionals, some clinicians on this this discussion, but I also know that there may be some that may not be as familiar. And so I want to start by really just kind of defining mental health and what that means, I certainly need to talk about the impact of COVID-19 on the mental health of our student athletes, but also on us. I know that this time has been really, really challenging. And then talk about the first aid kit, and first, what's in the kit for our student athletes, and then what's in the kit for us. And when I talk about what's in the kit for us, I talked about it earlier, the airline model. And it's really appropriate now when you think about put the mask on yourself before you put it on someone else. I think it's something that we are all going to be doing here over the next few years to make sure that we're serving our student athletes in the best way possible. And so, and then I really want to leave a little bit of time or a lot of time or whatever's necessary for questions and answers along the way. So if I could get a thumbs up to say that, Daryl, you hear me okay? I can see you. All right, great. Great. So when we think about mental health and moving into mental health and wellness, there are a couple of things to think about, but I want to talk about it from the definition of mental health based on the World Health Organization's definition. And so when you look at this definition, read it and think about the words that stand out for you, particularly if you hear the term all the time and you hadn't really thought about the definition. It's a state of well-being in which every individual realizes their potential, copes with expected life stressors, works productively and fruitfully to make a positive contribution to the community. For me, that definition wasn't the definition I was expecting, right? It's not the definition that you tend to hear on the news. It's not the definition that's portrayed in the media. It really does. You look at the use of the phrase well-being. It's a positive focus on mental health, and I love this quote: "You never give up on someone with mental illness. When you replace the I with we, illness becomes wellness." And I really believe that and I know we are all on this continuum of wellness, from mental illness to being healthy and well. And we're all on that every day. Every day we're somewhere on that. And I'll admit that during the last couple of weeks and the last months or so, I've been, a little bit on that more or less well end of that spectrum and challenged with this moment. And I know that a lot of our student athletes are, because of that isolation, because of the disconnection from that thing that really drove them. And we can think about it from our jobs perspective. Our job is that thing. We roll out of bed, we roll out of bed, take care of our family, but that job is that thing that we did on a regular basis. And we've all been hindered at that in some way. And it's been challenging. Well, I know personally it's been challenging. And so I want to acknowledge that, and I want to acknowledge the challenge there. And I want to make sure that that it's okay to talk about it. And that's part of the process with mental health. And so understanding that continuum of health, of wellness that we are all on and experiencing every day. And then, with our student athletes, there are stressors that are there all the time without COVID-19 lingering over our head. And they, you think about the academic demands, and if you think about it from the standpoint of, March 13th till now, the academic demands to manage online when you may be sharing space with a sibling, or you may not have the internet connection that you need, or you don't have internet at all. The academic demands that create those stressors for student athletes. And The pressures to be an athlete every day. Is you know, the workouts, they're hard, they're tough. You know, the family dynamics, and you know, understanding that there may be things going on at home, and you think about all of these aspects, these challenges that student athletes are facing, and then you think about our student athletes of color, especially our women, our women student athletes of color, and the environment that they may be facing on that campus, in addition to the stressors of being a student athlete, in addition to the challenges of the academic rigor, in addition to the challenges of getting in the weight room and competing, the pressures on them that can be overwhelming and frightening when you are a Black student athlete on a majority white campus. It's certainly something that we have to think about. And so our attention to mental health is really important, and understanding all of the pressures that come with being a college student athlete. And I know most of us, if not all of us, have been student athletes, and certainly have been around student athletes in our roles. And so those challenges, those stressors can really create a tough place and lead to some mental health issues and some ways of coping that may not be very adaptive. The anxiety and depression and mood disorders that show up in college athletes and college athletics, and you know, the challenges with relationships. And you know, we have all gone through this stage where we are still understanding who we are and developing as a person, and how we interact with others, and sometimes that can be challenging, and we may not have had the skills going into it that we develop once we were through it. And I guess that goes for everything, but you know, especially in the relationship space, and the trauma and grief that some of us have experienced, substance use, and how some of that stuff can lead to eating disorders, again, particularly with our female student athletes. And so, and you layer on top of that COVID-19, and you think about the challenges that our student athletes are faced with, and what was that impact when, you know, March 12th, I was, you know, in discussion with our track and field coach and team that was about to compete in New Mexico, and having to tell them that they weren't going to compete and come back home. And that impact on those student athletes and the challenges, particularly the seniors in that period of time before the NCAA made the decision to allow for those seniors to have that additional time. The stress that those student athletes went through, you think about the seasons getting canceled. At the time, we had a #1 women's lacrosse team, undefeated, that was really looking at a strong year. Our men's lacrosse team was undefeated and ranked in the top 5. We had a women's tennis team who was also top ranked and had just won the indoor women's championship. And all of these things are just disrupted. The majority of our student athletes were on spring break and had all of their belongings still at school. And so the abrupt transition from campus, all of that combined with everything else going on, it really, you know, can lead to some mental health, or exacerbate mental health issues that are already existing, exacerbate the stressors that student athletes face anyway. And it's up to us as administrators and coaches to really pay attention to our student athletes, to check in with them. And I say that not just from a mental health standpoint, but I think there's an overlap between the mental health issues that student athletes are facing and what's going on now when we think about what happened to Mr. Floyd and the reaction to all of that. This is a stressful time. This is a challenging time, particularly for student athletes of color, our Black student athletes, especially our Black men. I have a very sweet, naive 17-year-old son, and I'm scared as hell for him. Just from, I know he means nothing by it, but because of, his daddy genes, he's a big boy. And like I said, he is the nicest, respectful kid that you would ever want to meet, but he got my face. And so, and I have this, resting, what that face is. He has my face, and people are going to judge him in the same way that they judge me. And I'm scared as hell for him. And I know that there are student athletes who have been and will continue to be judged just based on the way they look, just based on their swag and the way they carry themselves. They will be judged, and it terrifies me. And so again, I'm sharing that because this has been tough. This has been tough, and preparing for this talk, it really got derailed over the last few days. And so just want you to know where I'm coming from as we talk about this. Everybody has their lens in which they look at things. Mine is through a mental health lens. It's through that lens of wellness and taking care of themselves, taking care of ourselves. And so when you think about that impact, I also want you to think about when student athletes begin to return to campus and what those challenges they're struggling with now may look like when they get back on campus. And so some of those things that you want to keep an eye out on and really and be in tune to are the changes that you see in those student athletes, from their mood, the various behaviors that they're doing, how their schoolwork is going. Do you notice a difference in their interest in their sport, in their interest in their friendships and relationships? You hear them say that they're not really feeling like themselves. They may talk about, wondering, what if I'm not here? And again, we got to pay attention to all of those things. And the more that we can educate ourselves on signs and symptoms like these, the better we will be. I will encourage you that if you're not a mental health professional or maybe not feeling as up to date and in tune with mental health issues, mental health first aid is a great training that I would encourage all of you to go through. It is a long training. It's a day long. It's an 8-hour program. But don't let that discourage you from getting some tools that can help prepare you to be a great advocate for student athletes. There are other trainings that are out there that I think that can be helpful. But I would recommend mental health first aid. It's a training that is widely used on our campus. 90%, maybe 95% of our athletic trainers have gone through that training. And I'll talk about our athletic trainers in a little bit. But paying attention to student athlete behavior when they return to campus, it's really going to be important in this moment. Paying attention to mental health, really important in this moment, as the challenges of being away from campus, the challenges of being isolated from all of those things that make us feel whole, our teammates, our routines, our friendships, they've been isolated from those things, and that can be a challenge. And from an emotional standpoint, in addition, as I talked about before, in addition to the stressors that are already there for student athletes. So really hoping to bridge this challenge is about putting resources in place for those student athletes. And we'll talk about that, but being attuned, and I want to leave this up just for a little bit longer, because there are things that are going to show up that I want you all to make sure that you're paying attention to with your student athletes as they return. Have a conversation with your mental health professionals on your campus. If you have a sports psychology team, have some conversations with them about how to interact. Encourage your coaches to communicate with your mental health staff about the challenges that student athletes are going to be facing. Encourage your administrators, your executive team to pay attention and be in tune to the challenges around mental health that may show up with student athletes. So where do we go from here? You know, there's a lot of anticipation about returning to campus. There's also a lot of anxiety about, are we going to be, are our campuses going to be prepared to receive our student athletes and to keep them safe within the midst of this pandemic? We're taking a tremendous number of steps at the University of North Carolina to prepare for our student athletes to come back. And we're taking it a little slower than some, in a gradual return, as a way to manage potential outbreak. And it's in lockstep with the expertise on our campus. We have some great experts, including Dr. Weber, who is one of the top epidemiologists in the world, who's walked through our facilities and given us advice on things that we should do and have in place before our student athletes come back. And so, in addition to that, there is a return to campus plan that addresses mental health and paying attention to the mental health of our student athletes. And so what does that mental health kit look like? And what's in your first aid kit? Well, I'll share with you some of the items in UNC's kit, but I'm going to be really quick in going through that. Because I know that not every school has the same access to resources. Not every school does things the same way. These are just some of the things that we've done to engage our student athletes around mental health. And so we've worked really closely. Again, your schools are probably doing a lot of the same things. I just wanted to point out some of the things in our first aid kit that has been helpful for us in connecting with our student athletes and connecting our student athletes to our mental health resources. There's been a great communication between our SAC reps and our sports psychology team, and our SAC reps have been outstanding in disseminating information back to their teams, back to their teammates about mental health. They've been very interactive in a lot of the programming that we do around mental health, and again, encouraging other student athletes to participate. Our clinical staff, we have 2 full-time sports psychologists, clinical sports psychologists on staff, Dr. Shannon and Dr. Carr, who both are tremendous resources for our student athletes. We also have a great partnership with our campus health and our CAPS department, and we work with them to help identify clinicians who can work with our student athletes of color effectively. And so we have a partnership there. And we're also looking to add to our mental health staff to make sure, again, making sure that we are attuned to the needs of all of our student athletes, especially our student athletes, our Black student athletes, our student athletes of color. I talked about the mental health first aid training for our athletic trainers, and I call our athletic trainers our academic support staff, those folks who are on the front lines with our student athletes are the gatekeepers. Student athletes go to them with everything. And it's important that we as administrators are connected with those folks, because they know what's going on. They have the pulse of the student athletes, and trying to provide them educational opportunities as much as possible, I think, is important, because again, they are the gatekeepers of information. And so those mental health first aid trainings for the majority of our athletic training staff, and they've been made available through a partnership with campus to other members of our athletic department. And we've had a good number of student athlete facing staff who've gone through that educational training. We've had panel discussions about mental health with our student athletes. We had a couple of mental health TED Talks put on by our student athletes that, they get up there and share their stories about mental health. And it is one of the most powerful things that I've seen is afterwards to see their teammates come up to them and hug them and talk about how meaningful their conversations have been. And we've been very fortunate. Our head coaches are bought in. We have what's called Blue Ops. It's training sessions. They're continuing ed opportunities that we provide for our administrators and coaches, and that has a tinge of mental health education in it. And it's all of these things that we have in our toolkit. But again, everybody's toolkit is going to look a little bit different. These are just some of the things that we've been able to do at North Carolina. And so as you think about your first aid kit, what are some of the things that should happen in order to have an effective kit? And I think creating a culture where help-seeking behavior is the norm is so important. I was fortunate to come into my role almost 2 years ago, and my predecessor was Nikki Moore, who's now the AD at Colgate. And Nikki's a clinical sports psychologist, and had already had helped create a culture and a buy-in for mental health and mental health education at North Carolina that I was able to easily step into. And so big kudos to Nikki Moore for putting some of that stuff in place. It starts at the top. Having your athletic director and your executive team bought into mental health is extremely important in establishing a first aid kit that helps support student athletes mental health first aid. Getting your head coaches to buy in and be able to disseminate that information down to their assistant coaches, where you build building the buy-in. Coaching, in my experience and being back around athletics in the way that I am, it's an old school kind of deal where you got coaches who've been at it for a long time, who are bought into the way that they were coached, and still trying to follow that and continue to teach that way. And a lot of that way doesn't include mental health. It includes suck it up and get back in there. And that was the way that I was coached. You better brush that off and don't let me see you cry. So when you think about that mentality, it takes strong advocacy to change some of the minds of those coaches. But it also takes a bit of reality and sharing with coaches some of the things that are going on, that they may not know about and may not be brought to them because the student athletes don't trust them with that information. And so establishing a culture really does start at the top, and finding student athletes who are advocates, who are willing to speak up. And it's not their job, in the same way that it's not my job to go and have discussions with all of our teams about racial justice or injustice. But it is a job that needs to be done. And so I'm taking on some of that. But finding student athlete advocates is important, I think. Again, the gatekeepers, the athletic trainers, the academic support, getting their buy-in, their participation, and making sure that they understand where the resources are. And so finding out where your resources, who are your clinical staff, are they part of your staff, or are they at campus health? Are they at the counseling center? But finding partners. Is that partnership with your social work, school of social work, or school of psychology? Or where are the campus supports for mental health for regular students on campus? And how do you work in partnership with them? We've had some events where we've invited those campus partnerships to participate. And so how do you do that? And how do you make sure, again, as part of your toolkit, having resources that not just you can refer to, but your athletic trainer, your academic support can have a connection with those resources as well, and be able to make those referrals when necessary. But I want to talk about putting the mask on yourself and building your own first aid kit. And I'm going through this pretty quickly. I wanted to make sure that I got through to this part, especially. And I want to make sure that if there are any questions that we can put those out, and I'll do my best to answer and follow up where I don't have the answer. Self-care is key. Putting the mask on yourself first before you put it on someone else. Making sure that you're taking care of your own mental and emotional well-being is extremely important, because the eyes of young people are on you. They're looking at you. They're taking a read of what's going on campus based on how you interact with them. And taking care of your mental health, taking care of your emotional wellness is extremely important. And during COVID-19, it's especially important. And so I want to share some of the resources that I've shared with our campus, I've shared with our staffs, and that I'm using myself to help manage the moment. Isolation has been a big part of COVID-19, where we've all, in some ways, in some parts of the country more than others, been asked to shelter in place and to stay at home. And so in doing that, we lose some of the routines that we used to have. And so finding an accountability partner, having somebody that you can connect with, avoid watching the news and social media. It has kept me in knots the last couple of days. And I've been bad about following my own advice, or this advice is not mine, but this advice. Making sure that you create routines. I have a few routines that I continue. One of them is eating, right? So I have not eating everything, but I have a routine about eating at certain times. It's a little thing, but it helps to keep me grounded. And so what are the routines that you can continue in this moment? And again, we're 3 months into it, but thinking about your routines. What are the routines? You're working out, walking, whatever those routines are, trying to keep those going as much as possible. Again, this helps to support your mental health and well-being. Connecting with friends, virtual hangouts. I'm going to a virtual birthday party this afternoon. and I'm supposed to bring some music, so I don't know about that, but I'm going. So these are things that help keep us connected to our usual lives and our emotional well-being, and it keeps us on that healthy end of the continuum of our mental health space. So really thinking about what are the things that you can do that even reaching out to others can be supportive for you, but supportive for them in knowing that you are genuinely thinking about them. It really does make a difference. And then as we think about self-care, there are resources that are out there available. Audible has, if you have children, you can use Audible to listen to children's stories, or have your children listen to children's stories. Peloton, I'm hoping that this offer is still available, but it was a free for 90 days, the Peloton app. There are other resources available. Again, Applied Sports Psychology, appliedsport.org. They have a tremendous amount of resources there for dealing with this moment. And then thinking about all of the apps that are out there for mindfulness and meditation that can help us to, again, manage the moment. Calm, Headspace, Buddhify, Insight Timer. Like there are a tremendous amount of resources and tools that I think can help us to manage this moment. Mood tools, again, finding things that can help you to manage your wellness so you can be better positioned to be the strong advocate that you always are. And what are the things that you're doing to take care of yourself? And always have to offer the National Suicide Hotline. As times get challenging, the National Suicide Hotline is a resource that all of us can use. And you don't have to be in crisis to call the National Suicide Hotline. They can help talk through some challenges, or you may be calling on behalf of someone else. And I just encourage you to make sure that you're doing things to take care of yourself. Mental Health America has some great resources on their website, including screening tools that you can use to help understand what might be going on for you. The Substance Abuse and Mental Health Services Administration has some resources. There are a tremendous amount of resources available. And so just want to make sure that we know all that's out there. So with that, I'm asking, what are you going to do? What are you going to put in your first aid kit? What do you need to help you manage the moment? And with that, I'm going to open it up for questions. And I can't see, well,
Daryl, you're talking, but I think you're still on mute.
Can you hear me?
Yeah, now we good.
Okay, sorry about that. I was saying thanks, Dwight. That was very helpful. And from being an athletic trainer and working with mental health professionals, and have taken the mental health first aid course, I'd say that is a great course for your entire staff to take. I think it very much prepares you from things. Can you speak a little bit about just how you go about developing a mental health crisis management plan and the importance of that?
Well, it's athletic trainers are one of those spaces that we really lean on because of the proximity to student athletes, the amount of touch, the gatekeepers. So putting together that plan is it's looking at who are the people that have that kind of proximity to student athletes, and getting together, identifying the resources. You put together this plan with your mental health professionals and their advice, but looking at your connections to student athletes, where are the resources, what are the steps that they can take in order to get the treatment, services, resources needed if in the event that a mental health issue should show up. It's extremely important that that process is in place, and leaning on those who are closest to student athletes, I think is a really important piece of having that first aid kit in place.
Thank you. Are there any other questions from the audience?
Yes, Daryl, I have a couple. Stephanie asks, is the mental health first aid free for the trainers to sign up to do?
It's free on our campus because we have our social work department has a grant that makes it free for anyone on our campus. There is a cost to it if you don't have that grant, or if that grant isn't available on your campus. There is a cost. It's I don't recall what it is. When I worked at the NFL, which was prior to coming to Carolina, we used that same training to train all of our player engagement directors. These are the guys, again, player-facing staff. They're interacting with the players every day, and it's a valuable tool to have in your tool belt. Doesn't make you a mental health clinician, but it makes you more aware of some of the challenges. It makes you more aware of the resources that you can use in order to interact more positively with student athletes.
Another question here, Aaron asks, what's the best way for administrators to share their mental health personal experiences that's effective for student athletes? Sometimes they may feel like they're oversharing.
Yeah, that's a tough call. That's a tough call. I may overshare because I'm taking every opportunity to do it. I'm sharing when I get that opportunity, and I think you have to be thoughtful about what you share, but the sharing that you've struggled, that you've had some challenges, that you've weathered those challenges, that you've taken steps to take care of yourself, that you've gone to counseling. There's nothing wrong with that. I think that is powerful, and that's something that we can all do if that's your thing. Because student athletes, I know that. So I've gotten up in front of our football team and I've shared pretty deeply some stuff that I've struggled with, and I know that they listen and respect me because in their eyes I've worn the boots, and I've done it at the higher level. And so a lot of them aspire to that. And so if I can share that, they'll be more likely to look at themselves and to come forward if they're in the midst of a struggle, versus pushing it down until it gets to a bad place. So I think that there's a lot of positivity in sharing in the right space, in the right moment. And that might be a conversation to have with your mental health professionals on your campus.
Thank you. Those are all the questions I have, Daryl.
Dwight, it's been a pleasure, my friend. Thank you for taking time away from your busy schedule to talk with us today. With that, we're going to close day one of our webinar. I'd like to thank to everybody who attended the symposium today. A short survey will be sent to your email soon. Please complete it as soon as you can so that we have your immediate feedback. Day 2 is tomorrow, starting at 12 noon Eastern time. Stay healthy and stay safe, and we'll see you tomorrow. Thank you.